glad that I'm really glad that we could have so many of you joining with us tonight. Before I introduce our distinguished speaker, let me just tell you that we will be taking questions tonight. And if you have a question, just write it in the chat. And then I'll ask our speaker tonight to try to answer the question that we have. So throughout the meeting, anytime you have a question, just go ahead and write it in the chat and we'll take care of trying to get an answer for you. So thanks. I tell you, it's my real honor to introduce Mr. Wesley Queen, our speaker for this evening. Mr. Queen is currently the director of the Legacy Leadership Institute on Public Policy Program at the University of Maryland School of Public Health. And he's going to talk more about that during his presentation, but basically he recruits and offers training and placement of Maryland residents over age 49 to volunteer service leadership in the Maryland General Assembly. Mr. Queen is also the co-director of the Community Engagement and Outreach Corps of the Maryland Center for Health Equity. And finally, he's a legislative guest lecturer of the health policy class in the School of Public Health. Mr. Queen is truly a Maryland leader in health equity issues, and we're so fortunate to have him here this evening for this event. So let me go ahead and turn it over to you. Thank you, Wes.
Thank you, Bill. Thank you very much. Hello, everyone. Welcome. Welcome to the discussion of the Legacy Leadership Institute on Public Policy and the discussion on some of the legislation that was passed by the last session of the Maryland General Assembly dealing with health and health policy. Let's go to the next slide, please. Let me talk some more about the Legacy Leadership Program. It began at the University of Maryland and Center on Aging. It began as a research project. The director wanted to take a look at that time, baby boom was 50 years old. Now I think it would be 60 if they were starting. But in any case, take a look at individuals who were 50 plus in age, who had retired from active careers, but wanted to explore or investigate some other area of challenge or interest. Because of the relationship of the University of Maryland as a state institution and its geographic proximity to Annapolis, the decision was made to take a look at the Maryland General Assembly and to see if a program can be developed whereby individuals who have retired would be able to, with some training, be able to volunteer as staff with members of the Maryland General Assembly. And as a result of that, the program was started in 2000 and it continues today. In fact, we presently have a class of 21 individuals. We meet on Tuesdays and Thursdays by Zoom presently, and primarily to explain to them and let them experience the Maryland legislative process. We do that primarily with lectures, although on last week on Thursday, we made a field trip to Annapolis to let the individuals experience some of the trappings, if you will, buildings, etc., of Annapolis. The other reason we did that is because what normally happens, individuals leave their home and then they travel to Annapolis, they park at the Naval Marine Corps Stadium and take what is referred to as a shuttle into the complex. I wanted them to experience that, although in the Zoom environment, we will not be doing that this year. But at least I wanted the individuals to experience and listen to some of the staff individuals experience what they would be doing in a normal year. There's such thing as a normal year, as opposed as traveling from their home to Annapolis. The lectures are primarily legislators, secretaries. We have lobbyists, all of the individuals that are involved in the legislative process. We try to get a representative to come and explain and discuss what they're doing as it relates to the Maryland General Assembly. We schedule these presentations in 45-minute segments, and which includes about 10 minutes for Q&A. Someone termed the word or the phrase repurposed, not retired. So that's a good description of who we are and what we are all about. Next slide, please. Now we're going to talk about the Maryland General Assembly. The state of Maryland is divided into 47 legislative districts. Each district has a senator and 3 delegates. The Maryland legislature meets in Annapolis for 90 days. You want to think of quickly when it meets on the second Wednesday in January and ends on the second Monday in April. They are referred to as part-time citizen legislature because they're only there for the 90 days. However, their responsibility does not end at 90 days. They have ongoing responsibility as it relates to committees, reports, their community representation. So the 90 days is simply for the meeting in Annapolis for the session. Also, according to the Maryland Constitution, there's only one thing the Maryland General Assembly has to do within that 90 days, and that is to pass the budget. That is the only constitutional requirement that they have to do. Of course, they do a lot more, but that is the constitutional requirement. And the governor cannot veto the budget. If the 90 days come, as has happened not often, and they do not complete the budget, they'll have to go into what's called a special session. They will not leave Annapolis until the budget has been passed. The presiding officers are in the Senate president, and in the House, the Speaker of the House. And they are elected by the members every 4 years. Elected officials introduce legislation to change or create a policy or law for consideration during the 90-day session. This year, however, we will have a special session, and that will be in December because we are redistricting. Maryland, like all the other states, following the census, will have redistricting. So there will be a special session to do redistricting in Maryland in December. And if the governor had vetoed any bills last session, some of those bills will be subject to what's called a veto override. That is for the General Assembly to decide that the governor made a mistake and that they will go ahead with the legislation. I may stop here to see if there's a question or two.
You have a question, just type it in the chat, please.
If not, we will go to the next slide.
Yep.
All right, we're still talking about the legislative process. One of the things that is also interesting and applies to most General Assemblies is that because we have 2 houses, most of the legislation will go to both houses. Now we have most of the work, however, is done by committees. There are various committees. The committees are primarily subject matter committees, for example, Budget and Tax, Ways and Means in the House, and Budget and Tax in the Senate. But most of the work is done by the committees. The members of the committees are selected by the presiding officers. They represent various areas, but for the most part, they are appointed to those committees by the presiding officer. The bill is introduced, but they're referred to as first reading. They don't, of course, read the whole bill. The bill is introduced to the full body. Then the presiding officer will assign it to one of those committees, whether it's Ways and Means or Budget and Tax, et cetera. Again, primarily because it's subject matter driven. It will then go to that committee. That committee will hold hearings, invite testimony, both for and against, and then that committee will vote to either approve the legislation or they will reject that legislation, or they will approve it with an amendment to change it in some way. After that, they then are sent to the full body for consideration on what's referred to as second reader. That full body then will listen to the information that the committee has recommended. The full body will then can offer an amendment. The full body will vote with the amendment, or the full body will vote to reject. If it passes on that second reading, as it's referred to, it then would go to what's referred to the third reading or the final reading. There are no amendments, however, on that third reading in the chamber that originated the legislation. For example, if it originated in the House, on the third reading in the House, there would be no amendments. However, because we have a Senate as well, when that legislation goes to the Senate, as it has to, you can then, of course, amend or make up whatever changes you want to. And then once both houses approve the legislation, in most cases, it then goes to the governor for the governor to sign or veto. However, in Maryland, the legislation can become law without the governor's signature. We're going to go down to another slide. We're now talking about a specific piece of legislation, the Maryland Health Equity Resources Act. Now you will note here Senate Bill 172 and House Bill 0463. That is unusual. Most of the time, it will be either a Senate bill or a House bill. Occasionally, however, when there's a lot of interest in a particular subject, they will have the same bill introduced and passed in both houses. That's why in this case, we have the Senate Bill 172 and the House Bill 0463. And you will note that each bill has a sponsor, has a number of co-sponsors, but the names you see and the individuals you see were the sponsors of that particular piece of legislation and the jurisdiction they represent. In the case of Senator Hayes, Baltimore City. In the case of Eric Barron, Prince George's County. I'll just pause here and make a comment as it relates to Delegate Barron. He has been nominated by the President of the United States to be the U.S. Attorney for Maryland. He has not had any hearings yet, but he has been nominated to be the U.S. Attorney for Maryland. It's something to keep an eye on. This particular legislation designates state resources to improve health outcome in communities without or with limited access to primary care. The important thing to realize on this particular piece of legislation is that these funds came to the state of Maryland as a result of COVID. These funds came from the federal government as a result of COVID. And that's one of the reasons, you note down there, we indicate that it was an emergency bill, which is a bill in which 3/5 of the members must vote on. But when there is something of immediate interest, which we think is for the majority of the state, it will then become an emergency bill. In this case, these funds were coming into the state, so they felt, and because of COVID, they decided that this was such a particular important topic. The legislation received bipartisan support and was signed by the governor. We're talking about previously about the governor not signing it, but again, bipartisan support, 3/5 of the members, and was signed by the governor. So it became law immediately. This is, again, because of COVID. Next slide, please. Here's a few comments about what the legislation actually does. It allocates $60 million statewide to eliminate health disparities. And we have a commission called the State Community Health Resources Commission. Will have responsibility for administering this. But it's the commission's responsibility to set up a procedure to establish pathways to health equity program to address disparities and reduce health-related costs. One of the significant features of this particular piece of legislation, it is modeled after the previous piece of legislation that has expired, where they referred to as the health enterprise zones. You may have heard that term. So that there is a track record, if you will, of some of the features that's in this legislation. That's one of the features I think that will make it, gives it some possibility of real good success. It also, because of this, that the communities have to demonstrate their ability to achieve significant health improvements. On this commission, which is the commission that will have responsibility for developing the RFP, proposal, et cetera, will include health experts and state provide guidance for elderly communities to apply for grants. So what has to happen, each state or each city, county would have to apply for this grant, part of this, the $60 million. I think we'll take a moment or two and poll the question that we have.
So we put a poll up that says, what impact do you think health disparities have on the performance? Is that what you wanted us to do? Launch?
Yes.
Okay.
Yes.
So we'll leave it open for a couple minutes if you could answer, and then we'll post the results.
5 to 8 minutes, maybe.
Oops. Mary, it was up, but then it went away.
It was up. Oh. Okay, so people are gonna, I'm sorry, you're gonna have to start over again.
There it
My
is.
apologies.
We'll wait.
So the people already voted. If they could vote again, that would be great.
Okay.
We're ready to move on to the next slide.
Okay, do you want me to show the results of the poll?
Why not? Yes.
Okay. Okay,
We're going to move on. Yes.
and here, can everybody see the results?
Mhm.
So we had about 77% of the people say a lot, and 23% said some, and 0 said none.
Well, that's a very good poll.
Hmm.
I think if you did that in most states today, on most counties, I think those numbers would be about the same.
Hey,
Thank you.
Wesley, we have a question that says, how does the Resources Act fit into the Maryland Commission on Health Equity, the Shirley Nathan Pulliam Health Equity Act of 2021?
All right, that is sort of a companion piece of legislation that also was passed at the last session, and also to address health equity. But the legislation that we are discussing right now, of course, even though it covers a similar topic, it does not become a part of that, the Shirley Nathan Pulliam legislation. That's separate. It has separate goals and objectives, similar, related, but different. So it is not part of that particular piece of legislation.
Thanks, Wes.
Yes, but it's similar. The next slide, of course, indicates, for example, the similar legislation to the one that we're highlighting. There were 2 of those. One was the HB 78 Public Health Maryland Commission on Health Equity, Shirley Nathan Pulliam Equity Act. and also the SB 741 COVID-19 testing contract tracing and vaccination act of 2021. They are related, similar goals and objectives, but definitely different. Actually, organizations and individuals that are involved in health equity, health disparities, almost have 3 different pieces of legislation to evaluate and determine which one they would like to apply for. For example, the 741 is primarily sets up procedures and plans as it relates to contact tracing and vaccination. The 78 primarily sets up procedures and all dealing with health disparities specifically. But again, they're all related. Next slide. We mentioned the emergency bill before, but again, this reinforces that
Oh, yeah. Wes, you're frozen. Wes, none of us can actually see you now.
He dropped off. I think he's trying to log back in.
Oh, okay, good. Hey, everybody, this is Bill Gray. I'm really sorry for we're having some technical difficulties. And we're having trouble getting Mr. Queen reconnected. I really apologize for this. We're trying to see what we can do.
Bill?
Yeah,
I have Wes on the phone now. He lost power at his house, so we're gonna need to probably reschedule it.
oh, okay. Okay, so what we'll do is Mr. Queen has lost power at his house, so he's really out of business. So what we'll do is we'll go ahead and cancel this meeting today. And we'll reschedule, we'll send you all an email, we'll reschedule it some other time and finish what we weren't able to get to today. I really apologize. And hopefully we can get you all back in and we can finish this very interesting discussion. So thank you to everybody. We appreciate you participating, and we'll get back in touch with you to define how we're going to handle this later.
Okay, looks like it's just us.
Okay. Well,
Well,
that was inconvenient.
Sorry, yeah. It's I guess we need to make sure we have contact information. I didn't think about it, right?
No.
Yeah, I tried calling him. I found a West Queen in Harper's farm, and then they called me. I don't know if that was them like looking up on the on my, I think on my email signature, I list my cell phone number. So
yeah, so we need a sheet for all our speakers, and it has all their address,
yeah,
has their address and contact information, everything we need.
yeah,
So from here on in, when we hire a speaker, we got to get all the details.
yeah.
But anyway, that was a freaky thing that happened. I don't know. So I guess we should have a contingency plan.
Oh, whoops, let me stop recording.
Well,